Hi, today we're going to be talking and discussing orthostatic hypotension. So, orthostatic hypotension is classified as a decrease of 20 millimeters of mercury or greater in the systolic blood pressure, or a drop of 10 millimeters of mercury or more in both the systolic and diastolic arterial blood pressure. One thing you'll see with these patients is also an increase in heart rate, about an average of 15 beats per minute or more on standing from a supine position. And we'll talk about it later, but it is more common to see in older adults and more prevalent in the morning when in supine as well. So a person can get it in multiple different ways. A couple of them that I'll list off for you is volume depletion, venous pooling, and prolonged immobility. You can just see that we also have some examples from depending on your diet or the nature of your lifestyle as well. It can affect the person in the ICF model, specifically the body function and structural level as well. But the main three presentations that I'd like to discuss with this one is that you're going to see more falls or mobility problems with patients, along with acute or chronic mental confusion and cardiac symptoms. So its prevalence is exactly how we said before, more often seen in older adults, and this can lead to some pretty nasty pathologies as well, such as MI or transient ischemic attacks. So just something to keep in mind and screen with any patient who does have orthostatic hypotension. And as a physical therapist, making sure that you're measuring the blood pressure of the patient in multiple positions, such as supine, sitting, and standing, as you can see from the picture from the pathology textbook. So medications that we could talk about, first we're going to do the non-pharmacological medications. The first one is a tilt table. So this is something that we can do to elevate the patient's blood pressure through different positions. And it's a good way to see from day one to see what their blood pressure is to day three in these different positions. The big thing that we can also advocate for is lifestyle changes, making sure they're drinking more water, limiting their alcohol intake, and avoid crossing legs when sitting. And very important to tell them to stand up slowly. They can use compression stocks as well to return that venous blood. Then you can see two examples of some pharmacological interventions used. And then the bottom two that are starred here, the reason that I put those is those are only used if the patient isn't able to make those changes in their lifestyle. So the first study I'd like to present is a study called Preventing and Treating Orthostatic Hypotension. It's easy as ABC. And they used a mnemonic then, A through F, to describe treatment strategies then to use with patients with orthostatic hypotension. As you can see, A, abdominal compression, B, C, D, E, and F. This paper did have great success then by using this, helping manage orthostatic hypotension with their patients, and it's something that you can keep in your back pocket then for your future practicing. The next study that I'd like to present is screening for orthostatic hypotension. I thought this was a very interesting article as it just came out in 2017. The first table on the left, that is criteria to, if a patient has just even one of these criteria, you need to make sure to screen for orthostatic hypotension, make sure that you regulate and monitor these patients. The table on the right then is some screening questions that this study came up with to screen in or out then orthostatic hypotension, as you can see here. And any positive response then from this table should prompt some further investigation for orthostatic blood pressure measurements as well. Dr. Schulte did present to us the top 20 things to know for the cardiopulmonary unit. Today I decided to discuss how orthostatic hypotension can relate to cardiac output, as we know that it does increase the heart rate due to compensation patterns. We can use our equation here and think about then that their stroke volume might decrease, or we may see a decrease then in that cardiac output. Just something to keep in mind with these patients then for your future practice. And then here's a list of my works cited. To keep in mind, there is more information in the pathology textbook about orthostatic hypotension, along with the two studies that I presented today.